The original rationale for the Strategic National Stockpile was to be able to protect the country against biological terrorism. The Strategic National Stockpile was used for COVID-19. However, from the very beginning, it was clear that there were going to be issues. Given that the Strategic National Stockpile was never intended to fully handle a national crisis involving all 56 state, local, and tribal territorial governments, that meant that supply chains would have to be energized and supplies would have to be provided through that mechanism. The first imperative is we need a bipartisan commission to look hard at the national performance during this pandemic. It should consider the basic assumptions that we've used in developing the Strategic National Stockpile and our emergency management doctrine. It also needs to consider what our expectations are of all levels of government, that is federal, state, local, and tribal territorial. The second imperative is that public health must be elevated to and receive prioritization and funding as a national security issue, in the same way that the Department of Defense and the intelligence community are funded and prioritized. So what conclusion should we draw from COVID-19? Some have called the coronavirus a black swan event. That is an event that is unforeseen. I reject this characterization. We have had ample evidence of the potential for a global pandemic. However, competing priorities, inadequate funding, and a lack of national focus led us to ignore this potentially existential threat until it was too late. Efforts must be made now to ready ourselves for such future events.